My name is Aslanova Makhlyodjo Raboyevna, Department of Obstetrics and Gynecology, Bucharest State Medical Institute, name of Abu Ali ibn Sina. Today's topic name is adenomyosis. Adenomyosis is subject to magnetic resonance image with signs of adenomyosis, including a white-not junctional zone. Its name is asterosis, causing thickening of the uterine wall of the anterior and posterior myometrium and high signal rate related to cystic changes and edema. Normal myometrium is higher in signal intensity than the darker junctional zone, like it's uterus, but there is have like two black spots. But transabdominal ultrasound shows an asymmetrical enlargement of the uterus with multiple subendometrial hypertonic linear situation. And how we different with adenomyosis, and if you ultrasound an anterior wall and posterior wall, it will be asymmetric. And irregular endometrial myometrial junction, multiple subendometrial also cyst. And transvaginal ultrasound, we can see adenomyosis. It's black stop, it's like inflammatory area. And it's we show in histological how we treat of adenomyosis. Treatment of adenomyosis, it's first line of non-steroidal anti-inflammatory drugs. Its mechanism of action decreases pain and abnormal bleeding from decreasing circulating prostaglandin. And second liner, it's combined oral contraceptive. Its mechanism of action atrophy on the endometrial tissue causing decreased menstrual bleeding, and progestins, it's atrophy of endometrium. We also use progestins as gestogen, and progestin releasing intrauterine device. It's progestin releasing intrauterine device. It's such as device Mirena. Atrophy of endometrium from local progestin. It's include levonorgestrel. It's we put inside the cavity of uterus. It's like to atrophy of endometrium from local progestin. And gonadotropin releasing hormone analogicus. It's hypoestrogenism and endometrial atrophy. And another line treatment. It's gonadotropin releasing hormone antagonist. It's endometrial atrophy, mild hypoestrogenism. And there is have adverse effect, but it's treatment of adenomyosis, pain medications. It's we say about it, no steroid anti-inflammatory drugs. After these hormonal medications, it's certain hormonal medications can help with menstruation and abnormal bleeding. Options include birth control pills, it's Depo-Provera injection, and hormonal intrauterine Mirena, like hormonal intrauterine device, such as it's Mirena. Non-hormonal medication, it's medications like trinoxin acid, can reduce the amount of vaginal bleeding if the patients have abnormal uterine bleeding. And adenomyoectomy, it's surgery to remove adenomyosis from your uterine muscle. This procedure is similar to a myomectomy, which removes uterine fibroids. But the last step, it's hysterectomy. The surgery removes your uterus. After a hysterectomy, you will not have a menstrual or be able to get pregnant. If you are ineffective with medicine, it's we doing hysterectomy. It's Mirena. It's placed in the uterus. It's not it's include hormonal levonorgestrel and such as to treat inhibit sperm from reaching fertilization and the uterine lining. And treatment of adenomyosis is, I said about it, it's adenomyosectomy. This have step by step. Adenomectomy is, you can see this picture. And more than actual problem, it's infertility and adenomyosis. And infertility and adenomyosis, presence of endometrial cavity, distortion are associated with reduced implantation and pregnancy rates. Women with adenomyosis normal architecture of the archimyometrium. It was destroyed owing to invagination of the endometrial glands and stroma. If very effective to adenomyosis, we're doing also recommend IVF. And macrophages have the capacity to produce not only pro-inflammatory cytokines such as TNF and IL-1, but also reactive oxygen spices that can be toxic to embryos. But severe adenomyosis who, after a failed implantation, have significantly greater stromal macrophage density than the non-adenomyosis. But it's additional diagnostic markers. And treatment of infertility and adenomyosis, it's gonadotroph releasing germinals, it's controlled trials exploring in the impact of gonadotroph releasing hormones on fertility under our understanding of adenomyosis. One case study reported that treatment of severe adenomyosis with gonadotroph releasing hormones for 16 weeks resulted in the live birth of healthy male infant. And during treatment, the ultrasound beams penetrate the tissue into the acoustic pathway and are then focused on the target tumor within the body. When the temperature increased to 65 degrees, coagulative necrosis occurs in the target tumor, and the acoustic focus region of the transducer is 5 mm wide and 8 mm long. It's like to these pictures have how its act mechanism, high energy focused ultrasound technology was invented at trained cancers by using the with ultrasound. These have the pictures. It's until treat, it's after treat. But these have some case history. For example, patients 31 years old woman presents to the gynecology clinic with complaints of progressively worsening pelvic pain and heavy menstrual bleeding for the past year. Its history of present illness, the patients report menorrhagia with menstrual periods lasting 8-10 days and requiring frequent changes of sanitary pads due to the heavy flow. She experiences severe dysmenorrhea that begins a few days before her period and persists throughout menstruation. The pain is described as a dull, cramping sensation and localized to the lower abdomen and pelvis. And she also reports dyspareunia, and over-the-counter pain medications provide minimal relief. In case of history of 2 full-term pregnancies, both delivered via cesarean section. It's like risk factor test to cesarean section. It's not history of endometriosis or pelvic inflammatory disease, no significant medical comorbid, no significant medical. And family history, no family history of gynecological cancers or significant reproductive disorders. Physical examination is general. The patient appears acute distress. Abdominal examination, mild lower abdominal tenderness, no palpable masses. If pelvic examination, it's to be manual, the uterus is diffusely enlarged, approximately 12 weeks in size, tender on palpation. And feels boggy and soft. No adnexal masses are felt. We put diagnosis, it's adenomyosis because it has very dysmenorrhea, pelvic pain, and management plan, it's medical treatment, yes, non-steroidal anti-inflammatory drugs, hormonal therapy. First line it's gestogen, we use only tablet Visana, also gonadotropin releasing hormones agonist. If you are ineffective, it's maybe surgical treatment. But there is have some questions with discussing about it, and thank you very much.